In episode 1 of Walk and Talk Improvement, we're focusing on partnering with patients, service users and carers. In this podcast, you'll hear about learning and applying quality improvement, capturing the voice of service users, and also how to become an active participant in improving health and social care. My name is Clifford Mitchell and I'm a Senior Regional Improvement Advisor in HSCQI, and this is a Director within the Public Health Agency.
And I'm Dave, a service user representative.
So our first topic is learning and applying quality improvement. I spoke with Carrol McCullough, who is a patient with a passion for quality improvement and personal and public involvement. Carrol shares her journey with us.
I had experienced a problem in care, and when I raised it, although I insisted I didn't want to make a complaint, I was told it was my only option. So I found the whole experience problematic, to say the least. I was not involved as a patient in a way that was constructive. It isolated me. I felt that it could have been resolved in a faster and much more efficient way by working through a process as a team. So then later, meeting patients, carers and staff at personal and public involvement events made me realise I was far from alone in my belief that not everyone wants to make a complaint and the complaints can cause problems. However, people do need to have the option to make one, and some can't be avoided. But what about the potential for choice? So when I came across information about the OCN Level 3 Award in Quality Improvement, I thought this might be an opportunity to explore the possibility of increasing awareness of alternative approaches to raise and resolve issues in care. So that would be alternatives that stimulate a shared purpose, a sense of belonging and partnership. Well, when I began the course and the project, I had not realised just how much detail and continued record keeping would be involved. However, the 5-step model of improvement helped me focus on prevailing trends and data, and overall, following the model helped me keep on track. We were advised at the beginning of the course not to be fazed by all the information we were given. Terminology and quality improvement tools, they're new to us, so that was a wee bit intimidating. Well, it was for me anyway. Yet as time progressed and with the help of those leading the course, it all came together and the process became more and more enjoyable. So evidence shows that a culture of collective leadership improves quality of care and sustained improvement of services. It's just when you're expected to work with others to make a common goal, you realise just how dependent you are on others. At the beginning, I had rightly or wrongly been nervous about stepping on toes, more especially as I was a patient and not actually working in health service. However, the staff were very helpful. They showed a real interest in what I was doing and they treated me as an equal. It was bringing people together, I think all at one time, that proved the greatest challenge and that created delays. Anyone involved was supportive of the project, but actually attempting to find a day when the stakeholders were all available was more difficult than I ever envisaged. Nevertheless, the support and encouragement were always there in abundance. And whenever you needed staff, they were there to help you with it. It helped me understand why quality improvement methodology is important. My idea of quality improvement had been that if something looked as if it made sense, it should be done. However, I can understand now how using quality improvement tools, it's a more targeted approach to diagnosing problems and finding solutions. Through completing the award, I gained the skills to follow a structured approach. And doing the course, it actually also provided greater opportunities to networking and collaborating in a team on the project. I found that finding others, patients, carers and staff I met during the course were on the same wavelength and had common goals. And that was very encouraging. I also enjoyed analysing the information gathered from engaging with the focus groups and actually speaking, being among those focus groups and listening to what they had to say. In the time available, a poster was developed based on the prevalent findings, and we did that using the continuous model of improvement. Working together in that has been an example of co-production in itself, so I was actually very pleased at the way that worked out and how everyone worked together. The poster itself can be used as a tool in future work, has been used in non-acute care and has been displayed in areas of the Southern Trust. An abstract of the work was also accepted for display at the International Forum on Quality and Safety in Healthcare in Glasgow back in 2019, and I was very pleased about that. I thought, this was something worth, doing and being part of. In the future, I hope to engage with the Southern Trust to build on the work by looking at the more human side of complaints and the impact on families and patients and the staff themselves. And I've also been asked to work by another trust with staff in their complaints department. So to sum that up, overall, I believe completing the course has also improved my skills and other work that I'm involved in. Because choosing to complete the Quality Improvement Award, it's definitely worthwhile for patients and carers. The award itself provides a structured approach to getting ideas off the ground. It helps develop skills, to put a plan into action. And it enables networking opportunities, which is really, really important. It gives you that chance. It's certainly the best approach I know of for a patient or carer to take if they want to kickstart an idea that they have for improvement. And, they won't be abandoned. I would say that they will be supported throughout the process.
Well, that was a very engaging conversation with Carrol, who shared her experience not just of learning about quality improvement, but also about applying the learning to her own quality improvement project. Carrol also talked about the importance of capturing patient experience data.
Now we will hear from Linda Craig, who is the Regional Lead for Patient Client Experience in the Public Health Agency. Linda talks about meaningful engagement with service users and carers.
It's called Patient Client Experience. Maybe I should just give a wee bit of indication as to what that is, because some people feel that's about complaints or investigations, and experience is part of that. It is people's experience of the health service. And unfortunately, it's been one of the only measures we've had for long enough. But patient-client experience is slightly different because it's about looking at people's stories. It's about understanding their narratives. So it's about going out and actually proactively seeking people's experiences and asking them their question. And it is way more than a few wee surveys. It's deeper than that. It's looking for richer understanding of people's interactions with the health service at an individual level, right up to how they think the system works. So I think it's from where I'm coming from today, it's about that relationship piece, that understanding of people's true experience, not the tick box, yes or no on a survey, but giving people their own voice and their chance to answer the questions in their own words when they wish to. So a lot of my work sits in that space. That's patient-client experience. And yeah, it could probably have a better name, but that's the one I inherited. So, I mean, we try to get the experiences and understand the experiences of everybody as part of that interaction. So a lot of the work we do, regardless of the methodology, is looking at what's the staff experience been, what is the family, the carer, the patient, the service user. I mean, we can use all these terms. I think maybe that's one of the complications, is just, first of all, how do you reach people? How do we get out to people and reach them, engage with people in a way that they believe is meaningful? Many of us have filled out surveys in the past, and we don't really know what happened, and we don't really know if it made any difference. And for many people, because we've heard nothing, we conclude nothing happened. So, I mean, prime example, last year, sadly, we had a bereavement in the family, and my father received the bereavement survey, which is an audit tool. And please don't get me wrong, these things have their place. These are really important pieces of work. They're just not the bit that I sit with. But my father threw the survey at me and he says, well, you may fill that out, because sure, who's going to listen to that? And they're not going to listen to me. And I think there's a big struggle in pushing against that culture where people think, well, sure, I'm not being heard and I've filled out my surveys and I don't see any difference in the system. So that kind of makes it very difficult to engage people in a meaningful way. And the other aspect of patient experience is, so that's taken it from a public perspective. The other aspect from my place of work is that there's many parts of the organisation aren't open to explore and experience in a proactive way. And a lot of that can be because A, they've never battled it before, they've never even heard tell of it, or B, they've been burnt so much with the negativity that they really do struggle to actually accept that this isn't about something you can hit somebody over the head with. This is a really important piece to help draw out learning. And I think it's when you start to talk about patient experience as a learning space, people can understand that, well, okay, if you can help me draw out the learning, then I can apply that, I can work with that, I have the ability to do that. But really in the past, most people just saw patient experience as a lot of complaints. Or how are we approaching it in terms of trying to get the experience word out there? First of all, we have to give people opportunity. We need to be able to bring in methodologies where the opportunity actually exists. So up until about 5 or 6 years ago, there wasn't a big sort of system to which people could engage with experience work. So the only route to which you could share your experience would be through the complaints process, which not everybody wants to do, because it can be quite an unwielding and maybe not really got the outcome to it that people are expecting. Or people that go down the compliments form route, which, to be honest, I've carried a compliments form in my handbag for weeks on end and never used it. My world has been about bringing in different mechanisms to allow us to gather this in a meaningful way. And I suppose maybe, I don't mean to go back on myself, but with regards to the negative stories, let me just highlight a wee bit of context in that. With patient experience, we have never had anything less than 72% of people saying that things have went well for them in the health service. There is that 28-30% needs fixed. We know that. There's many people probably listening to this saying, I'm part of that 30% that needs fixed. It's a massive system. But I do think we also have to be able to see when things are going well. And we've never been able to collect that before until we've brought in mechanisms. So I probably should talk a little bit around what they are. We look at Care Opinion, which is an online user feedback system. We look at 10,000 More Voices, which is a way of analysing people's narrative. But this is one of the ways of doing it. A solution to experience work is bringing in opportunity, opening up opportunity. The other piece is proof of concept. I think it's really important that we can demonstrate to people very clearly that if you are part of this, if you are part of our experience analysis, or you're in part of, say, even much wider scope, sort of the PPI world, if you're part of these focus groups, if you help us with organising or co-designing or co-producing or whatever these opportunities look like, that there's a result to it. And so we work quite hard on proof of concept on that. So we're looking at, so if you share your story on Care Opinion, you will get a response from the service. But equally so, I have a responsibility to collect all those stories, analyse those stories, and get that up through the system to the people at the top with the money that can make the difference. And this is a culture shift, and this won't happen overnight. I've been in my job for 4 years now, and I'm slowly seeing it shift. If I could actually reflect on COVID for 2 seconds, COVID opened doors for us that we never had before. So again, looking at opportunity, developing opportunity, harnessing that when it comes, but able to show proof of concept is really important. So one of the pieces of work we've been trying to get into was care homes. Then COVID hit, and the care homes was one of the places that was most affected by the pandemic. Really difficult space for families and residents and staff. And it gave us in 2020 and 21 the opportunity to do studies with people through sort of virtual online mechanisms, yes, which was very hard to reach the residents. So we were very much relying on the care homes. But as the care homes open up, this needs to continue. We need to keep up this continuous conversation with these areas to allow us to demonstrate where things are going well and how we do it over and over again, if that's the case. How do we keep that going? How do we assure ourselves of that? But then also where we need to make the changes, how do we make the meaningful change using their voices and keeping them engaged? So maybe you can see a wee bit of how some of what I do in patient-client experience actually engages with the involvement world. You know, the two collide every so often in terms of going out and understanding the broad spectrum of experience and then working out, well, how do we make these changes happen and how do we include people in developing that and being part of the change and shifting things. First of all, I reflect on how people think success is in patient experience world. People think the success is in the large number of returns in a project. And I have to say, yes, the more stories we get in, the more information we have to analyse, the more we can tease out. That's amazing. And being able to be representative to the best of our abilities of that experience. So, for example, experience of engagement with social work. But actually, how I know it's made a difference in my world is if I can get that information into the right forums and they inform the change. They make the change happen, and they make the difference. The other way to look at patient experience work is, I very often will talk about patient experience being the sharp end of the sword. I truly believe, and it's not just to keep me in a job, that patient experience is the so what of it all. If we can demonstrate, no matter what we do in the health service, if we can use patient experience as that real final piece that just demonstrates what change looks like, what the services do and how it's impacting people. I was reading something last night about magic moments and tragic moments in the health service. And do you know what I mean? There's absolutely no one's experience in the health service is fully positive. And actually in those ones that are really negative, people can tease out how there has been positive elements to it. So there's something about patient experience allows us to demonstrate the complexity of the health service, the complexity of the interactions with the relationships between the actual practitioner and the patient or the service user or the family member, whatever way you want to call it. So I do think we have to put patient experience in its place. You know, we do have that proactive approach from the leaders now coming to us wanting to robustly gather people's experiences. And the bit I need to push them on is if you hear from it, what are you doing with it? You've got to learn from it. So we don't take on any project unless we have the commitment of forums where the change can happen. So how do I know it works? Well, I know it's working if I have people coming looking for the information. I think that's a real positive. But I know it's working if I can go back to those groups and ask them how they've made use of the information. So, I mean, one of the best examples we had from COVID was a large project happened in Easter of 2021. And it was going out to residents and families and staff to say, what are we going to do about visiting in care homes? Which was really difficult. Some of the hardest stories we ever had to read. Families absolutely appreciating in many cases trying to protect the residents, but actually missing the final days of their loved one. It was heartbreaking. But also recognising the need to keep people safe and keep communities and care homes safe. So it was a massive political hot potato. But in many ways what we did was we went out and we gathered those experiences and we analysed them. And those have been used to inform the pathway for the executive.
So that was Linda Craig with an interesting insight into how engagement with service users and carers is supporting meaningful change within health and social care. Finally, John Fitzsimons, who is a paediatrician at the Children's University Hospital in Dublin, talks to Bernie O'Reilly from Patients for Patient Safety Ireland about how people can become active participants in improving health services.
Thank you, John. And Patients for Patient Safety is a WHO worldwide network, not just in Ireland, and all across the world. And it was established in 2004 with the signing of the London Declaration. It was brought to Ireland in 2013 by Margaret Murphy. And Margaret was one of the original 24 signatories to the London Declaration under the guidance of Sir Liam Donaldson, who was a very empowering man and was seeing the value of the patient voice. So he appointed Margaret the external lead advisor for the WHO Patient Safety Network for the whole world. When Margaret brought it to Ireland in 2013, she created a collaboration between patients, their families, carers and the HSE. Members of our group we're basically people with stories of harm in healthcare. It's our own stories or the story of a loved one. We share in the spirit of learning and to bring about improvement in patient safety. So we're volunteers, people from all walks of life. I live and work in the farming community, so I bring my own story with me. We feel that we all win when patients speak up. So it's our health service, and we bring knowledge. Healthcare professionals bring their skills, and patients and service users bring their lived experience. And each patient or service user comes with a support network, and that network are their families, their carers, and often we're the voices of the vulnerable and the voiceless. So we feel we have a part to play in patient care. We're more than the stories of harm. Like, the outcomes of the harms created in our lives can't be undone. We'd love if we could have new endings to our stories. But we have to move beyond that, and we want to be active participants in building a stronger, safer, fit-for-purpose health service. And it's been varied. I've had some great opportunities, a chance to understand how our health system works, its strengths, its weaknesses. Sometimes I found in the past I used to take on too much and get overwhelmed. Sometimes I'm out of my depth. I'm a layperson in a world of academics and healthcare professionals, but maybe people need to hear our stories and feel unsettled and work for better outcomes. And we need to see the good works and the challenges and challenge the system that fails people. Well, I suppose I came into the group with a total level of mistrust for healthcare professionals, and I suppose I've swung the other direction now. I mostly see good stuff. I see that sometimes we bear witness to all the good that's going on, and sometimes when we get involved in things, we're out of our depth in our knowledge base, and sometimes we are just observers of the hard work of other people. I think that one thing I'm glad to have got my confidence restored in healthcare, because it's a very difficult position for a patient to be in if you don't trust the service or the healthcare professional that you're dealing with. You're in a very, if you're already vulnerable, you're actually even more vulnerable if you don't trust the service that you're handing yourself over to. So for me, I needed to find that trust again. And then I suppose when my daughter got involved in healthcare, I started to kind of, I listened to her worries, and I know that the worst thing in her life would be if she harmed a person. And I think that is the case with all healthcare workers. Their worst nightmare is if they harm a patient. And I suppose I've got a better understanding of the human frailties of, fear and failure. Well, I'd definitely still be in my place of mistrust if I hadn't got involved, and I just have a better understanding of our health service, its frailties and all its good outcomes and good inputs as well.
And that was Bernie O'Reilly, who clearly demonstrates that voices from all walks of life are crucial as we strive to improve our health systems in Ireland. And that's it from us for this episode. And thank you to Carrol, Linda and Bernie for sharing their experiences with us. Remember, you can listen back to this and other episodes wherever you get your podcasts, and please subscribe to get notifications when new episodes are added.